Today we're going to go over some oral motor stretches and strategies that you can do if you're working with a baby who might have a shallow latch when you're breastfeeding or bottle feeding. Hi, I'm Kelly from Feeling Yum. I'm an occupational therapist here to help you with feeding tips and strategies. So this is my daughter Alana. She is 2 months old now, a little over, and we were struggling with some shallow latch due to she has a lip tie, but now that lip tie is released. So if you're wondering what a lip tie is, it's when there's a piece of frenulum, a tissue that's connecting your lip to your gum, and it's keeping your lip really tight to your gum. So she was having difficulty opening up her lips around the nipple when she was breastfeeding, or even with bottle feeding as well. And so there can be cheek ties or tongue ties as well. But with her case, we went to a airway-centric dentist and she helped us with the release. So we released the top of her lip, which means they do a little cut with a laser, and then she's able to now have that space and open her mouth. And the signs of having a tie, which we were struggling with, is she had that shallow latch, but the signs are I had a lot of soreness on the nipple area, so I was getting some calluses and some bleeding, because when they're latching really shallow, then it's hard to get like a true suck and get a true feeding, and so also your feedings might be less. She wasn't losing weight, she was doing pretty good, but that is the signs. So when you go to the dentist, I'll just kind of explain how the procedure goes. They do a consult first, and during the consult, our dentist was saying hers wasn't too severe, so we almost backed out of doing it, but I'm glad my husband was there to push me to do it, because after we got it released, they did it that day. I had a lot more success with breastfeeding that next week, and the soreness was gone, and I was really happy. But during the consult, they did recommend to see a lactation consultant just to work on stretches and everything after the procedure. And so I'm really glad I did that, because then a week later, so she was kind of going back to that shallow latch. So the lactation consultant, and I had learned these too, being a feeding specialist, going over oral motor stretches really helped with this process, because even if you're not having a tie and your baby's just kind of having maybe difficulty latching on that bottle, or with breastfeeding in general, or you can do these stretches. So it could, or maybe you have a tie and you are hoping you don't have to get a release. So these stretches could help with that. Or also they can be really good with if you had a tie and after the release, like us, we're still working on those stretches, because we just always want to get that really open mouth, and it really helps with the feeds. So I'm going to show you some, and then if you stay till the end too, I'll show you also a couple different holds you can do. So I think it's easiest if we place her on my lap, and of course you want to do this when they're in a happy mood, because you want to keep, anytime you're dealing with the baby's face, you want to make sure that they are happy, and we don't want to cause any aversions. So I'm going to show you, I'm going to go over 6, so we can, 6 different strategies, so you can kind of, and I'll put them on the show notes, so you can go through them one by one. So the first one is called a fishy face. So I'm going to just, like it sounds, we're gonna just squeeze her little face. So 1, we can do about 3. You talking. And we're gonna do 2. Hi, Alana. And then I'm gonna do 3. So yeah, I wanna make sure she's in a good mood. How's that feel? So that's just a really good stretch, just to get the whole mouth kind of moving in the beginning. And then I'm going to show you, it's called a TMJ massage. Yes, Alana. She has a lot to say about it. Right? You know these stretches. So the TMJ, that's your transmandibular joint right here. So it's like when you get a lot of tension you get a lot of tension right here, like we do as adults sometimes. And so on the baby, it can be the same thing. It's just kind of releasing some of that tension. So we can kind of massage, and then you can keep going down that jawline. So it's just to more relieve tension for this massage. All right, Alana. And then I'm going to move on to the lips. So this will be the third one. And this is because we really want those lips to go around the nipple if you're bottle or breastfeeding. And so we really want to open it up. So I can do, it's like a mustache. So you're going to go 1, 2, 3 on the top lip. And we can do on the bottom, 1, 2, 3. So again, just giving awareness and stretching. And then you can get your thumbs and you can kind of go down right under the nostrils 3 times and on that crease right here, just to kind of stretch it out and give her awareness of that lip. Yes, Alana. And for tension there as well, we can kind of give a little massage right here. Right. How's that feel? And then the next one is called hip hop gapes. So this is to work on a gape reflex. And this one I really like if you're just short on time and you just want to do one before a feed, just to work on that open latch before you're going to breastfeed. So you just are going to start. She's getting a little hungry probably. She's bringing her hands to her mouth. So I'm going to bring them down a little bit, Alana. And so we're going to go on her nose, to her upper lip, to her chin. So this one you just kind of go like this. So she has a reflex to kind of open here, but we're just going to keep encouraging it, that natural reflex. Right, Alana? And you can do that, 3 times or a few more, and that one is really fun to do. And then, yes, what do you think? Is it okay? So I do want to go into her mouth now. So you just, you can use, I'm not using gloves. You just want to use wash hands because I'm her mom. So I'm just going to go into her cheeks to stretch out her cheeks a bit. So I'm going to come in here and we're just going to massage. And then we can come out. We can come on this side and massage. And you can pull out like that. And you can even do it, pull her a little forward. So your head's on my lap. And you can do it too. You can even go in the direction of her upper lip a little bit. So you can massage and come up towards her lip and come out. And you can do that on the bottom as well. But yeah, if she's showing any versions or anything too, you can stop. So you want to always make sure they're happy with it. Right, baby? And so this one, I can try a little more to go to the bottom. And I was kind of not doing it towards her lip, top lip too much in the beginning when she was sore. So right after she had the release, we were kind of just doing this stretch as well, just to kind of show you, to make sure it didn't reattach. And then the last one I'm going to show you is like little stretches you can do for that muscle in the very back. It's called the pterygoid muscle in the very back of their mouth. And it's also just her chewing. So she can chew like 12 to 15 times, but less is fine as well. And this works on the gag reflex too. So she kind of has an overreactive gag reflex, so it's good to kind of put toys or fingers in the mouth. So when she starts eating, she's not gagging when we like put the bottle in her mouth and things. That's the side, and then I can kind of do my finger on this side. And also this stretch is really good too, because when you put your finger to the side, the tongue will follow, and it's good for the tongue. She can see her gag reflex is a little strong. It's just chewing, but yeah, it's good that her tongue will kind of follow my finger. Yes, you can help me. So that's it. Those are those exercises. I'm going to show you a couple holds that are also good. I'll show you one more on my lap. So this one, you can bring the baby over your lap and have her drape over a bit like this. And this is just to stretch that upper body. And you can even do the exercises this way as well. You know, like you can massage her this way. You can do those hip hop gapes and things like that with her head hanging, and she can look side to side. So that's just to keep stretching, because the more we stretch out, sometimes even if they had a tongue, their tongue was tight in their mouth or things like that, all these stretches will elongate with time as they get older. So hopefully if you have a tongue tie or something like that, they might grow out of it too if you're doing all these stretches with age and with the help of the exercises. So the last position I was going to show you is when I do nursing. It's called a koala hold. So it looks like she's like I'm holding a little koala. And so you have her legs come on either side. And then when I have her, I just position her this way. So when I bring her to the breast, she's going to want to breastfeed. But when I bring her to me, that means she's kind of having to like open her mouth wide, because as she's coming to me, I can kind of show you one more time. The nose goes to nipple area, and she kind of has to like reach. She has to drop her bottom mouth to reach for the nipple. So that's a really good position to encourage that open latch. And so those are the strategies I wanted to show you. So just to review, we went over, the first one was the fishy face, then the TMJ massage, then we did the lips, and then we did the hip hop gapes, and then we did some cheek massage inside, and then some chewing with the finger, and then I showed you just how to drape her over and the koala hold. And then the only other thing I can say that is good to do for stretches and preventative and post-care for ties is you can look for a body work specialist. So they work with cranial sacral therapy or cranial sacral fascial therapy, or you can see a chiropractor, and there's a lot of different specialists I can list in the show notes too that help on stretching the baby, and all this kind of helps with that. So I hope you found this valuable, and please like and subscribe so I can share more content like this. Thank you.